Hello everyone. Today is day 40. 40. 40. I remember when I got my diagnosis and went to see the breast surgeon and she's like, yep. I said, how long is it going to be till we get moving with this? And she's like, 2 weeks. That was 40 minus 14 days ago. Anyway, it is what it is. So hi, I'm Jen. I have a new view of you today. I thought the timing was actually good right now because the sun's going down and you can actually see, woo, you can see the shadow of my setup here. So I thought I'd keep it on here to show you just like how easy it is to do vlogs yourself from home. So here's my tripod right there, and it just clicks on here right there to screw in to your phone. Fun fact to know that if you hit, at least on an iPhone, if you hit the power button and the volume up button and hold it for long enough, it calls the police. I unfortunately learned that the hard way when I was tutoring once, and I hit those two because I was trying to center my phone on the tripod and didn't realize that I called the police, and then I think I realized I made a phone call and then I hung up right away, and then police called me back and they're like, is everything okay, ma'am? And I'm like, oh crap, oopsie. So yeah, be careful where you put the phone. It doesn't have to be centered on the tripod. And yeah, these little artsy craftsy things are things I did during the pandemic. So other fun fact. I'm stalling because next to me, as you can see, is my printer. And today needs to be medical information day. I had 4 doctor's appointments today, I think. Yeah. I had a virtual this morning, and then I had 3 at Newton Wellesley. I can't even remember what they all are, but most of them were, the cardiac doctor to get, the cardiologist, you would call it, to get clearance for the surgery. And again, that was because I had COVID. I had to pick up some files and stuff of imaging, whatever, and then polish off my day with a COVID test, which I haven't had a COVID test in a while. That's a technicality. I mean, the pandemic's still going on. So you have to have a COVID test before you go in for surgery. So it's like as much as it, like today's Tuesday and the surgery is Friday, and I think I'm all set to go, it's like I still have to wait on the COVID results and have to wait for tomorrow. I'm having an echocardiogram, which I learned is basically just one big ultrasound of this area to listen to your heart and other stuff around your heart. It's like one big rectangle. Yeah, I've never had an echocardiogram before. So the appointment, since we're in medical talk today, that's the focus of today. The cardiologist appointment was basically to go over family history and what my COVID experience was like when I had COVID, what things are still going on for me now. I continue to get better. There was, people have Googled me. There was an article that someone in town had written an article in the online newspaper about my journey with COVID as a long hauler. I don't like to label myself. I really don't. Like, yes, I had COVID, and yes, there's some symptoms that I still have. My sense of smell came back after I had my first vaccine. My sense of taste came back a little bit after my second vaccine, and is not 100%, but is far better. And it's almost like you have to retrain your brain to recognize what foods should taste like what. Like I just had sushi for dinner and I could taste every part of what I was having. While I had COVID, it was interesting because I had no taste or smell when I had COVID, which is a very unique experience. Like all food tastes the same. So when you're eating things, it's basically based on texture, you know, how soft something is, whether something's crunchy. It's not like the whole idea of stress eating isn't there because the taste isn't there to give you the warm fuzzies like, oh, I'm eating ice cream. For me, it's like I'm eating cold and either soft or hard. It's a very bizarre experience. And then what you do taste, at least for me, was your taste buds are still working, even though tasting foods doesn't happen. So what I mean by that is I can taste things I can sense that things are salty, spicy, bitter, like coffee, sweet. I can taste like those sensations. Like if I have coffee, I know that it's bitter, but it doesn't taste like coffee. It does now, but it didn't then. So it was very interesting. And it's a process. As I got my smell back, the first thing I smelled was ketchup. I had it sitting on my bedside table from breakfast, and it was like, boom, all of a sudden my smell came back, and I'm like, what is that horrid smell? I wasn't used to smelling, and it was the ketchup that was sitting on the table, or on my bedside table, and it was just so strong. And I'm like, oh my gosh, like all of a sudden everything's in sensory overload. So I'm still not so much what I'm smelling, because I think that's coming back more and more. There's not a ton of things that I don't really smell. But with taste, it's a conscious thing as to when I'm eating something to think, okay, I'm eating, like today, I'm eating salmon, and this is regular salmon, so it should taste like this, versus this is smoked salmon, so it should taste like this. So it's making that like vocabulary connection of smoked salmon, you put it in your mouth, and then knowing what it tastes like. I can tell you right now, I could not decipher the difference between smoked salmon and regular salmon. And for me, usually I'll get like really simple sushi things, but I like getting raw smoked salmon because of that smoky flavor, and I can't taste the smoky flavor on the salmon. It just tastes like I get the little twinge of salmon in there, of the taste, but not the smokiness. So it's not back 100%, but it's way better than it used to be. So that's the COVID part. So it was super creepy taking the COVID test, to be like doing that again. The process is just annoying. It's nothing major. But it was in like this building by itself literally outside of the hospital. I had to like walk up a hill up to the next building to get to the where they were doing the COVID testing site. And then one guy, oh my gosh, this is partly why the pandemic is not over yet. We're standing in line. We're standing in line outside because they were closed from 12 to 1, and my appointment was at 1 o'clock. And there's clear markers on the ground that are painted that say 6 feet apart, keep your distance. So like I was standing first by the door, and the next person was actually 2 spots over. So people were actually standing 12 feet apart, which was nice. And then, over a period of like 10 minutes or something, there started to be a line of people that had appointments. And then the last guy online comes up without a mask. Like, granted, you're outside, but the point is you're taking a COVID test. And he comes up and he's like, oh, do we need to wear masks? Is that still a thing? And I'm like, oh my God, yes, it's still a thing. Oh, oh my word. Like, what if he tested positive and he's just walking around? Do we still have to wear masks? No, sir, the pandemic is over. You just missed the memo. Really? Anyway, I was not standing near him. I was the first one in there. In and out, I was all set. And I've been super diligent. I've been wearing my mask, every time I go outside, even in the hallway to my apartment, because I do truly think that that's how I got COVID in the first place, was the passersby in the hallway. We had a faulty fire alarm board or whatever, and it kept going off. And that's the only time I could think of that I was around people to have gotten COVID. I truly don't. I mean, who knows? I can analyze all I want. Same for this. You can try to figure it out as much as you want. Who knows? But the point is, because I had COVID, I had to get cardiac clearance. My EKG was fine. Everything that she looked at was fine. My blood pressure, oh my gosh, my blood pressure was 112 over 82. How normal is that? And my trick of the trade, for those of you that get the white coat high blood pressure thing going, when I'm sitting in the waiting room, I'll open my phone up to the Calm app, and I just look at the home screen, which is like this like brook with like water trickling down, whatever. It's just, and I don't have the volume up because I don't want anyone else to hear me or hear the phone. And I just like watch the brook, or there's one with like raindrops on leaves. There's like 7 different things to choose from. And I just watch it, pretending that I'm there in the middle of the forest, you know, listening to the babbling brook. And they call me in and I'm like 112 over 82. That's a record for me. Like that's pretty awesome. So yeah, and again, tied on with that, I normally take Bayer. I've been off of the Bayer. You're supposed to be off for 7 days, so I have been off of that. Everything else with my medication has been the same. They said to stop supplements, although I take vitamin D for my kidney stone, and they're like, keep taking that. I have a pile of medication to pick up, which is probably on one of these sheets that I'm gonna pull out, and I haven't even taken them off my printer because I didn't want to, but I'm going to do it just for you. And just own all this stuff. I have 1 bag that has medication there, and I have to go back and pick up another bag of medication that was called in for post-op, pain medication, antibiotics, and some other stuff that I don't even honestly remember. So I'll find out when I go pick it up. I did also today get rid of the pink. It's gone. These are my nails. No nail polish. I mean, I can put nail polish on, but I'm over the pink. I truly am. I'm just not a pink kind of person. As I'm sitting underneath the pink tree. It's got red and purple in it too. And like owning all of it really, like like my top, I this morning I put this top on and I went to go in my underwire bra drawer because I normally would wear like a white or a flesh color or nude color bra to go with this because it's a light color. And I'm like, oh yeah, I'm not wearing those underwires, and I could, but I don't want to. Wires just seem like they shouldn't be near the ladies right now. And I'm like staring at the drawer like, was not in a place to put them on. They're my old bras. They don't make me feel good. It reminds me of like the sagginess, which again, I thought was just because I was getting older, and still could be, I don't know. But the point is I'm not gonna need those bras pretty soon. So I go to look for my sports bras and my little, what are they called? They're like sports bras, but they don't have this kind of neckline. Demi something or other. I don't remember what it's called. I have a light gray one and I couldn't find it. It must be in the wash or whatever. And I'm like, my hair was down earlier. I don't really care. But then I'm like, now this is showing, which is my sports bra. And you know what? I'm like, after a while, I don't care. I went in the middle of town and got my sushi and saw people that I know. And I'm like, I just don't care. I don't care what people think, whatever. And what was so interesting, there's this one police officer in town. And it's like whenever I seem to be in a huge bind of some sort, I always tend to run into him. Don't know why. Total coincidence. Who knows? I have to say, Bedford police they're fantastic people. They really are. He's helped me out a lot in some predicaments in the past. And there was once when I was walking on the sidewalk to meet colleagues of mine that were having lunch across the street, and I wasn't paying attention to where I was going. I don't even know. Maybe I was looking at my phone. I don't remember. But there's a huge orange pylon in the middle of the sidewalk that I just ignored and just kept walking. And I looked down and I'm like, oh, it's mushy all of a sudden. And I'm walking in wet cement. And I look up and I see him. And I'm like, just sitting there with my little Keds on in wet cement. And I'm like, I look up and I'm like, I don't even know what to do right now. And I think he said, like, did you see the pylon? I'm like, apparently I walked around it. Oh, yeah. And I said, like, I don't even know what to do. And he's like, well, step out of the wet concrete. And then the fire department happened to be right there. So they told me to go inside the fire department with their big hose, and they hosed off my feet, and my colleagues are sitting there eating their lunch, watching the show. This was years ago. And then he said, like, make sure you go home because you don't want concrete, like, in your nails and between your toes or whatever. Anyway, so when I was leaving the sushi place, I saw the same police officer. And I'm like, how funny, because I haven't seen him in a long, long, long time. And he's like, how you doing? And it was just literally, I'm coming, he's going, we both got sushi, whatever. And I'm not going to get into a whole story. I don't know him well at all. But I was just like, I'm fine. No, I'm not. But I left it there. I am fine. Not like I'm fine. Like I truly am fine. I'm feeling okay today, which is why I have this out. So let me get to the brunt of this. So lots of messages in the gateway, lots of things to print out. And that's what I'm going to go through with you. So I'm just kind of plowing this out here of things that I have that are just information to know and to help you with cancer and just life. Because as the first one I'm looking at is the therapist from the cancer center, and there's a coping plan. When I had the vlog about you're only 100%. I got that from my session with him. I actually have a session with him tomorrow after the echocardiogram. So, I mean, the chart I'm looking at right now, I'm not going to read this word for word. We'd be here all day. But the second chart, there's a chart on here that I like, where it says there's certain steps in your coping plan, and it says ask yourself the following questions to regain some perspective and sense of control. Am I doing the best I can with what I've got right now to make the most out of today? You could do what you can do. Planning ahead is not always the way to go. And things to focus on for yourself, there's the physical stuff, making sure you're eating, taking care of yourself, getting enough sleep at night, which I'm not. Last night was the first time where I actually had a dream about something cancer related. In my dream, I had the drains. I don't remember all the bits and pieces. I usually have very vivid dreams when I do remember my dreams. I had the drains, but I had clothes on, and I was telling people, get out of the way. And they're just these, things flapping around. And that was the focus of the dream that I remember, is these drains just woo, just these. I just picture them these long strings with this little grenade on the end flapping around, getting in the way. Watch, I get it. It's this big or something. I don't know. Getting enough sleep, making sure you're staying active, but what you can tolerate. The mental part about telling your medical team about, your concerns that you have. One thing I actually called randomly about today was one of the doctors on the team had told me to not shave my underarms for a few days before surgery, but then I didn't hear anything about that from other doctors on the team. So I called the nurse today at the breast center and I asked her, and she's like, oh, she wasn't positive what to do, and she understood why you shouldn't shave. So, so I need to stop shaving. It's Tuesday, Wednesday, Thursday, 3 days before surgery. You're supposed to stop shaving your underarms. I imagine if they go in there to, I don't even know how the procedure works with them testing for the sentinel node, but whatever they're doing in here, because that's where your lymph nodes are, if they have to get in here, they'll shave it, obviously, but it's easier for them to shave if there's stuff to work with versus if you have an ingrown hair or whatever. Oh, this is nice. Make a plan for each day with projects that will help keep you occupied. Not that kind of thing. This took forever. Schedule activities that you can look forward to. Emotionally, make time to do things that you enjoy. Spend time with family and friends. Just kind of complicated with COVID. Look for support in people groups that understand your experience. That's an interesting one. That's it for here. I say that's an interesting one. Even as I'm getting my nails done, or undone, I should say. I was talking to the woman who does my nails. I've been going to her for years. And just sharing, there's only one other person in the salon. And the woman next to me turns out that she's a breast cancer survivor. And I'm like, there's so many people out there who are. Statistically, it just makes sense. Number-wise, that you'd run into people that are. She's 11 years out. She said that she asked me if I was getting a double mastectomy, and I told her yes, and she said she wished she had done that because she did it in one side and then ended up getting it in the other side too. But she's been 11 years cancer free, and when I did the math going backwards, I'm pretty sure she was 49 when she got cancer, and I'm 49 too. So it's interesting hearing her story. I mean, there's you know, there's such different stories, even though you think, oh, we're on the same team because we have breast cancer, but the stories are so different based on age, based on preferences, on treatment. You know, some people just don't want to have certain treatments versus others. Some people don't have radiation and they just do chemo. Some people have radiation and don't do chemo. She was on tamoxifen for 10 years. I didn't know. She said that you're only supposed to be on tamoxifen for 10 years, which was interesting. And again, I'm not giving medical advice. I'm just sharing what I heard. I'm not a doctor. Yeah, she said you're not supposed to be on tamoxifen for more than 10 years because it increases your risk of uterine cancer so highly. And then I'm thinking, as people like my age get older, you know, your uterus is not always your best friend. And if you're done having children, you know, you don't necessarily need to have your uterus. I know that that opens up a whole ball game of stuff with hormones and hormone replacement and whatever, even just as you're going through menopause. But yeah, it's interesting because I know a few people who've had hysterectomies that I thought were relatively young, but things go wrong with your uterus, especially as after you have kids, and you age, you know, so much time goes by, whatever, and your uterus just starts doing funky things, and then you throw in menopause and all this other stuff happens. Anyway, yeah, so even within people that have had breast cancers, the stories are just so different about what people want to do. All right, so this one, I'm looking ahead. I probably should not read this in order because this says discharge instructions, but this one says surgery, so maybe I should start with that one. And again, I'm not reading all of these. I will read them on my own, but for time's sake. Look, this this is a pre-COVID picture. You would never have this discussion in 2021. What's wrong? They're not wearing masks. I'll get to that in a second. How interesting. Look how happy she looks. Anyway. All right, so 8/20/21. Surgery. Good afternoon, Jen. Blah, 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 blah. They are so super helpful there. So, the vocabulary words: bilateral skin-sparing mastectomy and right sentinel lymph node biopsy with lymphoscintigraphy, which is a dye injection, and immediate reconstruction. That's a lot of words. All right, all that matters is, I told you they told me to get off the Bayer for a week. If anyone's on Bayer, they also told me not to take supplements, like especially fish oil. I can take non-steroidal anti-inflammatories, which I personally don't take because I have FMD. But you can take those up to, I believe it's 3 days before surgery. I didn't pay attention to that one too much because I don't take anti-inflammatories anyway. And I think you still could take Tylenol up to the day of surgery. Again, do not quote me on this. Please, I'm not a doctor. I don't even play one on TV. All right, so the night before surgery, you are to have no food after midnight, which forces me to go to sleep early. And then only clear liquids up until 2 hours prior to the procedure on the day of surgery. Whoa! 5:30 a.m.? Holy cannoli! That's so early! Does that mean I'm supposed to be there at 5:30 a.m.? They told me it was 6. Oh, you know why? Okay. My surgery time is 7:30. So 2 hours prior to that would be 5:30. I'm like, do I have to be there at 5:30? I think I have to be there at 6. I'll find out soon. Let's see. New policy. Clear liquids include water, apple juice, cranberry juice. To me, that's not clear, but whatever. Pedialyte, black coffee, clear tea, or any other beverage that is translucent. Not clear liquids would be milk products, orange juice, alcohol, alcohol. I don't plan on swigging some booze before my surgery, or any other beverages containing pulp or that are not translucent or not clear liquids. The night before surgery, you are to have nothing to eat. Didn't I just say that? Nothing to eat after midnight, but then clear fluids up to 2 hours prior. It's in shouty caps, but maybe they just want to make sure it's important. Your surgery is scheduled. Here we go. In bold letters. Your surgery is scheduled for Friday, 8/20/21 at Newton Wellesley Hospital. Arrive at the surgical center. It's so weird to process this. It's so weird to process this, like, here. I'm trying to catch all of everything authentically with all of you. Arrive at the surgical center by 6:15 a.m. That's early. But with lymphoscintigraphy at 7. That's the dye injection. Oh, this is good to know. Remember to contact your insurance company prior to surgery. That would be helpful to make sure my insurance is covering all this stuff. What would you do? Like, not do it? It is necessary for you to be preoperatively checked via the pre-testing department to clear you for anesthesia, which they already did that. Right? Yes, that was last week. Okay. If you're taking Coumadin, aspirin, or any other non-steroidal anti-inflammatories, please notify pre-testing. If you're diabetic, please inform pre-testing. I'm not diabetic. They tell me what my doctor's name is. Occasionally they have delays. That's fine. You'll be asked during your stay your name, date of birth, allergies, and operative site multiple times, which makes sense, I guess. Like, if you're only doing one side, they want to make sure they get the correct side. When our preoperative team is ready, you'll be escorted to the second floor pre-op area and will be asked to change into a hospital gown. The nurse and anesthesia staff will complete a pre-procedure assessment, take your vitals, and insert an intravenous line to give you IV fluids. This may take an hour. This is a lot for me to be reading this on this. I'm trying really hard to be poised right now. Once the operating room is ready, the OR team will arrive to ask you a few questions and bring you into the operating room. Fast forward. When your procedure is completed, you will be transported to either the post-anesthesia care unit, the PACU, well, now I know what that stands for, post-anesthesia care unit, or the day surgery area, depending on the type of anesthesia you received. I'm going to be at the PACU, I know that. Recovery times, you can anticipate being in the PACU for 1 to 1.5 hours. If you're staying overnight, which I better be staying overnight, you will go, it says will go. Should I tell them they have a typo? You'll go to the appropriate patient care area in the hospital. This will occur approximately 1 hour after you arrive in the recovery room. If you're going home on the day of surgery, once you're recovered from anesthesia, you will go to the day surgery area while they're prepared to go home. Yeah, I'm not going home. I've got too many mixed things going on. If you were directly, blah, 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 blah. Oh, so if you are going to go home, they'll review your home care instructions with you and answer questions. Thank you for choosing our hospital. Okay. I'm so confused right now as to what I was even looking at. All right. Sorry, I'm getting a little numb here. I don't even know where to go here. Okay. This might not be in order, but whatever. They gave me this booklet which is pretty much the information that was discussed in the phone calls. Talks about the drains, and it has pictures of them. Lovely. I had sushi, and now I'm going to be looking at pictures of drains. I hope I don't vomit. Let's see what else is here. This is just messages I already printed. Discharge instructions. Is that the same as this? I don't even know. This is a lot. Yeah, this is the same message. All right, so I'm gonna put this here. I've been told I can be very poised. I don't want to cry. It's a lot to digest. So, drains. This part is from my plastic surgeon. I'm scheduled for a bilateral mastectomy. It was just 40 days ago, man. An immediate reconstruction with my plastic surgeon's name. So discharge instructions. Drains are used to remove extra fluid that may build up around the surgical site. Excess fluid may interfere with surgical site healing. Just so that you know, I'm reading this really for you. I'm not digesting anything else anymore. I'm toast already. But I feel like if I even read through these things briefly, it will help me in a little while when I shut this off and read through it again. As I say, call the doctor's office if you experience nausea. I'm having a little bit of nausea right now. All right, big girl pants on. They have a video with instructions on how to empty your drain. I'm not ready to look at that. Not right now. Empty your drain every day. It's like peeing. Pee every day. Empty your drain every day. Is that what they say to boys? Like, there's your drain. Go empty it in the toilet every day. Your nurses will assist you with this before you go home, and a visiting nurse man, the typos. A visiting nurse will review it. It says review it at home if one has been arranged for you. They are arranging a visiting nurse for me. We'll give you a sheet to record how much fluid comes out of the drain. Wait for it, because that's coming up. Where is it? Here it is. A chart. See, I like charts because I'm a math person. Alrighty. Lots of words. It's so funny. Like, at this point, this sheet just has a whole bunch of letters on it to me. All right. We'll give you a sheet to record how much fluid comes out of the drain. Please see attached. Bring this sheet to your plastic surgery follow-up appointment. Probably good too when you fill out the sheet to take a picture of it with your phone in case you do miss the, take the sheet with you, whatever. You could probably do it as a PDF, by the way, too, and fill it in. That's not really how I function. I would rather put it on a sheet of paper and then just take it with me and then take a picture with my phone to be on the safe side. Okay, your drains will be removed at your follow-up appointment if the amount of fluid collected over 24 hours is less than 30 cc's for 2 consecutive days. The cup is marked. Drains will be removed over the first 1 to 3 weeks, depending on output. If you have more than one drain on each side, which I will, only one drain will be removed at a time from each side. I did hear that. I heard the first 2 would get removed after the first week and then the next removed after another week or 2. So here's the chart, drainage record chart. I don't want to put names on there, so I'll just do this. That's the chart. It goes up to day 14. I printed out more than one just in case, but that's what the chart looks like. It's coordinated, which I like. Different colors are good. Maybe I'll use fun little markers to fill it in. Caring for your surgical site. Leave your clear plastic dressing in place until your follow-up appointment. Is it saran wrap or would it be press and seal? We'll soon see. You'll be given a bra to go home in. I'm sure it's full of lace and leather. Please wear this at all times, 24/7, until your follow-up appointment. I get that, but it's not comfortable to sleep in a bra. Or drains. Like, how the hell am I supposed to sleep in that? Maybe that comes up soon. And this, by the way, is just for my doctor, keep in mind. So when I did have the other appointment with the other plastic surgeon, she told me I would not be able to shower for a bit. So when I say here, it says you may shower after 48 hours. You may shower starting 48 hours after surgery. So that's not the same for everyone, obviously, because that was not the case with the other plastic surgeon I spoke with. So, and again, it's individual. So this is just for me, just to give you a heads up. Please remove your bra. Why would you shower with your bra on? Well, whatever. Remove your bra and attach your drains to a belt or necklace made from strings so that they do not pull on your skin. Or they told me a lanyard. I don't want a belt in my shower. To me, I think like belts just laying there, not using them for like pants. I think like, oh, you know, spank the kid with the belt or something. It doesn't give me warm feelings. And a necklace made from a string. I don't want a string around my neck. And I talked about that. I'm not good with knots. So I have the lanyards. Please do not submerge or soak your incisions in a bath or pool until cleared to do so. I'm not a bath person anyways, that's fine. Don't plan on swimming. That may be up to 3 months. So for you bath people out there, might not be able to take your, or at least submerge your incisions in the bath for 3 months. Or go swimming for 3 months. Which has to be tough if you're like a swimmer. Do not, capital N-O-T, place any kind of heat or ice on the surgical site. The sensation to this area is altered and it can injure and interfere with blood flow to the skin. I don't know if I'd mentioned that already or not. I know this is going to be a long one, but I want to go through this before I vomit and I can just move on. Because I really am getting like acid shit in my throat right now. It's just a lot of information. What was I saying? Oh, feeling. I don't recall if I said this or not. But because they're not, you know, I don't know what kind of sensation I will have in this at all, really. I don't, because there's no tissue there. So I don't know what sensation I will have. The nipple thing is interesting because they're not able to keep my nipples. So they make one, and I'm not sure at what point they put it on. I don't know if it's after you heal from the original surgery. I know they'll do it at the right time, so I don't really care to ask right now. But what's interesting and something to mourn is that you don't have nerve endings going to that fake nipple. So you don't have sensation in the nipple. Scientifically. I know, you know, people that have body parts that are amputated have that like ghost whatever syndrome that it's called, where you can, you know, someone who might have gotten their leg amputated and has a prosthetic device and says, oh, I can feel my leg, even though it's physically not there. I'm hoping some way that I can train my brain to be able to have sensation in my nipples again. I mean, yes, it's great that if it's cold outside, it won't affect anything. But it also sucks from a woman perspective, or men, to not have sensation there, like in a sexual way. To know that you'll never have that feeling again. Of that sensation of like having something cold touch your nipple or something. In a pleasurable way is my point. That makes me mad too. All right, moving on. Nipples are so small, but they have such an impact. So the sensation to that area can be altered or is altered and it can injure and interfere with blood flow to the skin. It's just crazy. Out of everything, I'm like talking about my nipples and I won't be able to feel anymore. So it's getting me upset. Because like I'm packing in the tennis and I'm packing in the kayaking and all these things I still can't do. But I don't want to touch them. I almost don't want to know what it feels like to have sensation there before I have the surgery, because I know I'll never be able to feel it again. And I pray I could do some sort of mind over matter thing where I can actually have that sensation. And this isn't about a partner, it's about me. All right. Now I can't see. Activity. Sorry. Do not do any of the following until your plastic surgeon clears you at your follow-up appointment. Don't lift anything heavier than 10 pounds, no more than the equivalent of a gallon of milk. Don't raise your arms straight above your head. Don't use your arms to do any strenuous activity that raises your heart rate or causes you to break a sweat. I should have had tissues here. I have a towel. I have my laundry I haven't all put away yet. So I'm going to use my towel as my tissue because I have mascara on. All right. When you get home, you should walk around the house several times a day. Avoid exercise or activities that bring your heart rate and blood pressure up, as this can increase swelling at your surgical site. If you were given a booklet, or maybe it's this one, I don't know. Hold on. If you were given a booklet with stretching exercises, please do not initiate these until after cleared by your surgeon. Good to know. Some medications after surgery, which I briefly talked about. I'm not going to mention exactly what they're prescribing for me, but there's pain medication, there's over-the-counter stuff, and they're prescribing 2 different pain medication. One is nerve-related, and one is just, it's oxycodone. I mean, I've been on that before for the kidney stone. I know that it works for me. Infection prevention, antibiotics. I'll continue to take those until all the drains have been removed. The pain meds they give me for 2 weeks, and the oxycodone is only like as needed for severe pain if the Tylenol doesn't help. A probiotic. Oh, this is something I still have to do, actually. They gave me something for a probiotic, but truly, I use Yarrow probiotics, Jarrow. They sell them at Whole Foods. Those work really well for me. I use probiotics, like, anyway. Not recently, but it does help with, like, your gut, giving you good bacteria and increasing your good bacteria in your gut, which kind of undoes the destruction, I guess, of the good bacteria caused from the antibiotic, or being on the antibiotics. So they did give me a probiotic, but I think I could just take my own, is what they told me. It says continue to take it for every 2 hours. I'm sorry, not every 2 hours. Take one either 2 hours before or 2 hours after you take your antibiotic. Otherwise, it'll kind of cancel each other out. And take the probiotic for more than 1 week. For 1 more week after you finish your antibiotic. Constipation, fun. I guess from the anesthesia, it makes you constipated. You may need to take a stool softener and or laxative. I don't want to take a laxative. Colace, I've been on stool softeners like when I was pregnant and stuff. They're not harsh stool softeners, so I'm fine taking that. Important medication information: don't take non-steroidal anti-inflammatories like Advil, Aleve, ibuprofen, or Motrin until you're cleared to do so. They can increase your chance of bleeding after surgery. I have to ask about the Bayer. That's something to note when I can go back on the Bayer. Resume all home medications unless otherwise specified by your surgeon. Follow up with any of your primary care to obtain new prescriptions or to update them on your recent surgery. Diet, no restrictions. Woohoo! That's exciting. There you go. Ben & Jerry's cookie dough ice cream every day. Well, no, that won't help with the constipation. Drink plenty of water to help prevent constipation. And then they tell you that you'll receive a call 1 to 2 days after surgery to check in on you and answer any questions you have. Your surgical oncologist will call you with your pathology results. Oh boy, that's not going to be that will be enjoyable because they'll come back and say, you're good. Usually in about 7 to 10 business days. I forgot about that part. That's when they find out what stage you're at, and that's when they start talking about if there's other stuff you'll need to have done. I just keep looking there because I have to pick up Caleb soon, so I want to make sure I finish in time. Yeah, the pathology results. So like when you get cancer, like if someone, you know, the first question people usually ask is, oh, what stage are you? With breast cancer, you don't know that until you get the pathology back from the breast tissue. They can tell you like a number based on clinicalness because of the size of your tumors, but not as a matter of progression. And then call the plastic surgeon if you experience high fever, 101.5 or higher, chills, nausea or vomiting, not including vomiting or nausea from reading about having nausea or vomiting on this, shortness of breath, leg pain, which I guess would be a blood clot maybe, worsening pain at your surgical site that's not relieved with pain meds, and signs of wound infection, redness or tenderness at or drainage from your incision, or if you have other concerns. And of course, if things are severe, call 911. I guess I printed this out twice. Good, so I guess it's less paper than I thought it was because I printed this all out twice. Yeah, so there's that. This is just medication I'm on now. There's this COVID stuff. I'm telling you right now, this is making me nauseous. I was going to stop, but I don't want to stop. I don't care if this goes over an hour. This is stuff that needs to be covered. And I don't want to talk about this more than one day on here. So, all right, rewinding. I'm sorry, I'm like sniffing up icky. All right, time and place and check-in process. Make sure you've registered in advance of your surgery. I should register in advance. This should be done prior to the day of surgery. Well, good to know that I read this now so that I can do it and call. I feel like they've already done this because it says your surgeon's office will tell you the time you should arrive, which they already did. I think I just read that to you. They tell me basically where to go once I'm in the building. Check in. I got a package. Thank you for whoever got me sent a package. Oh, the cheese. Did I mention the cheese? My friend Stephanie sent me, she's like a cheese connoisseur. She sent me like this has nothing to do with this whatsoever, but just, I need to pause from this for a second. She's like a cheese person. Like, oh my God, she like travels and does all this stuff. She's a person that comes with it, like a charcuterie board to like events and parties and whatever. But she sent me this variety of cheeses and crackers. And when I saw it was from her, I'm like, please let it be cheese. And it's like literally there's probably 15 kinds of cheese. Oh my God, Stephanie, thank you so much. And the same thing, like, I don't know Stephanie super well, but like we have a lot in common. And I just so caring and like, what a way to your heart is through cheese. And then yesterday when someone dropped off dinner and I realized that it was just me for dinner, the kids weren't, or the kids were with their father. which they were supposed to be. I flaked on scheduling because it was his birthday. But the kids weren't with me, and then someone brought dinner, and I'm like, you know what, the dinner's just for me, so I can pick really, what I want to have. But she also brought flowers. She brought red roses and sunflowers, and I'm like, what a gorgeous combination. And the other flowers I had were dying, so, and I didn't, like, get rid of them. They were just sitting there, but dying. So I have dying flowers on my table, and then she brought those, and I'm like, they're just so pretty, and they're different because it's sunflowers and red roses, and it just made me happy because they weren't pink. I've done the pink thing. I'm good with the pink thing. I don't have to love pink. I had my time of being soft, and I think that was good at the time. And when I do put my nail polish on, I have a lot of nice hues of blue to choose from. Okay, back to schoolwork. So, check-in process, because it's COVID. If you're reading or watching this in 2025, I hope COVID's over. I should say 2022, but I really don't think it's going to be all over by then. Please wear a mask on the way from your car into our facility. Well, that's interesting. You'll be issued a disposable one upon entry. I'm quite aware of that because I spent a lot of time with that. Check in the main desk, which I did today. There's a surgical liaison available. It's like having a concierge. My surgical liaison. They can give me information updates to, oh, this is interesting. So let me read this more clearly. There is a surgical liaison available from 8:30 a.m. to 5 p.m. Monday through Friday. They are available to give information and updates to the families of surgical patients throughout the day. Oh, that's nice. Now, I'm not going to have that go to my kids, clearly, because I don't want them to be the first ones to know about stuff. I'm going to filter that through my friend Barb, who's going to be staying with me. So Barb, if you're watching, you're my you're my updater. Well, she knows this. We've powwowed about all this stuff, but you'll be the person that the surgical liaison ties you with. I'm not even speaking English right now. They provide information about the start and end time of surgery, recovery updates, day surgery pickup times, patient room assignments, and inpatient, I almost said inpatient, inpatient visiting information. Oh, and they give you the number for the surgical liaison. Awesome. Note, send that to Barb. Visitors, each surgical patient may have one support person or visitor. They told me 2 on the phone. But honestly, I'm not even sure who's going to come visit, and it's COVID, so I don't know. Barb, I hope is going to come visit me. And I asked one other friend to come visit. Yeah, I don't know who's going to come. Guidelines for eating and drinking before. Well, we already talked about that. You may brush your teeth at any time. Just spit out after rinsing. What would you do? Swallow it? Why would you swallow toothpaste? So the eating part, after midnight, the night before surgery, there's no solid food, chewing gum, or hard candy, or mints. I know they told me mints, even though it's not on here. And I already told you about the drinking stuff. For the 2 hours immediately before your surgery, you may have nothing by mouth other than any medications that you were instructed to take. What to bring? She said some people bring nothing and some people bring a suitcase. I don't plan on bringing a suitcase. You may bring your cell phone. I'll be like, hey, got my anesthesia. Just kidding. I'm not doing that. Wear loose, comfortable clothes and no cologne, please. Crap, I can't wear cologne. Damn it. No value. They also told me, it's not on here. They also told me like no lotions, no body oils, that kind of stuff. No valuables, no credit cards, and no money. Well, that's interesting. It's all free. Huh. No credit cards or money. That's interesting. No jewelry is allowed. All piercings must be removed. If you wear glasses, bring your case. We will store them while you have your surgery. Don't wear contacts on the day of surgery. So without my glasses, I can't see a friggin' thing. So that'll be like interesting. I won't even know what's happening. They'll ask me to look at something and check if that's my name. And I'll be like, what, Shani? I can't tell. And then there's the COVID stuff. which I think that's pretty much the last thing. There's this booklet, but I'm not reading you a booklet beforehand. I'm actually even getting tired of this. So if COVID-19 is still going on, the pandemic is still going on, I will just overview this, which really, actually, what the heck is the point? Like, everything changes with COVID, so I feel like there's no point in even reading this out loud, because, like, literally every day, COVID regulations change. So I'm not even reading that part. I mean, I'll read it for myself, but I'm not reading that part. There's the Delta variant right now, and, I mean, literally every day is something different. So what I read now could not be true in another hour from now or 15 minutes from now, so I'm not even going to bother reading that. So here's the happy people after breast surgery with reconstruction. Well, she's happy, and she's like, it'll all be okay, ma'am, but this is not COVID, because if it were, they'd probably both be testing positive very shortly. So, they're nice and pretty. I mean, it's got blue graphics. That's nice. This book, oh, big print. This booklet tells you what to expect and how to care for yourself while recovering from breast surgery. That's a very big font. You will learn how to manage any pain you may have and how to care for your incisions and drains. Be sure to follow any specific instructions your surgeon gives you. Font change. Oh my gosh, I'm not reading all this stuff, but it's a very handy thing. Tips to keep you comfortable. How will I feel? Support your arm. Let me just whiz through this real quick and just tell you what's important. You'll feel tired. No duh. Your body's low on energy. Really? Make sure you get plenty of rest. Well, you would be doing that if you're on pain meds. Eat well. Let others do things for you. Most people feel upset after breast cancer surgery. Common feelings are worry, anger, and loss. Healing physically and emotionally takes time. It is a marathon, not a sprint. Ask for support from others. We are here to help you. Call your plastic surgeon with any questions about your recovery. All right, so this is new. Your arms can pull your arm can pull or put pressure on the area of your breast surgery. To support your arm in a comfortable position, put a pillow or folded towel under or behind your elbow when you're sitting or lying down. Weirdly, very weirdly, the chair I'm in right now, you can see that, has very comfortably 90-degree angle arm rests. Behind your elbow while you're sitting or lying down. Sometimes a pillow on your lap or over your abdomen can help too. Riding in the car. Ironic that this is by my feet right now. This will be my pillow for riding in the car, which again, I'm not going to be driving, so I can just like do this, and I have cushioning here, and I have Tex the Taco too, so I'll put this here for now. It actually matches my shirt and kind of my bra. How weird. Place a small pillow between the seatbelt and your chest to lessen any rubbing or pressure on the surgical area. Talks about medication, which we already talked about. Do not drive or drink alcohol or do activities that require concentration or coordination. What requires concentration? Parenting. Do not parent? Is that what it's telling me to do? How do you not parent when you have children? It tells me the medicine that I'm going to be on, what's over the counter, what's not, and then infection prevention, which we talked about. I feel like I'm teaching, which we talked about, boys and girls. Oh, muscle spasms. Well, that's interesting. Ativan. They're giving me Ativan? I don't like Ativan. Take a 0.5 milligram every 6 hours as needed, if provided at discharge. I hope I'm not on Ativan. I don't like Ativan. It's very much a roller coaster for me. It's very much a roll. People are on it and they're great, but for me, it's like I did take it years ago. Tried, and it's like you're feeling great, then you're not. Then you're feeling great, and then you're not. I don't like Ativan. Constipation. You can take a stool softener, which we talked about. Oh God, pictures. Ah, crap. Whoa. This is disgusting. This is disgusting. This is nasty. I should not have eaten sushi and then be reading this. Pictures. Damn it, pictures. Look, it's like a cow. Women are like cows in so many ways with the, I don't mean like heavy wise, I mean like the udders and the milking. Milking the drain tubing. Look at that. I didn't want to see that. But now you can't unsee it. Look. Here's the other pictures. Pictures. Ooh. What grosses me out is that it's like clear, which I guess it needs to be clear, but then all the gunk that's coming out, you'll be able to clearly see it. Milking the drain tubing. I've never milked a cow. I guess now I'll learn. Oh, but I did pump when I breastfed. Does that count? It is common for clots to form in the tubing, which will clog the drain. Lovely. To keep the tube open, you need to milk it. God. You need to milk it at least twice a day. I'm going to milk it as much as I can. Not the tube. I mean, just in general. Milking the drains means sliding your pinch fingers along the tubing to push any blood clots into the suction bulb. I'm sorry. I have a very inappropriate mind right there. Oh, sorry. Crap, I have to get going. I have to hurry up. I'm glad I'm laughing. This is all the stages of this process, and this is making me sweat. Okay, how to milk a drain. I gotta do this here. I know I'm at an hour. I don't really care. All right, how to milk a drain. Insert cow sound effects. Woo. With one hand, I'm sorry. I'm going to use a pen for this. With one hand, okay. With one hand, hold the drain tube in place close to the skin. Pinch it firmly so it doesn't move or pull on your skin. It seems so inappropriate to me. That's why I'm laughing. With the other hand, pinch your thumb and index finger around the tube. Slide your pinched fingers along the tubing. Pulling downward to push the fluid toward the suction bulb. So like here's the udder from the cow, and you're going whoop, whoop, to get the milk out. Oh my God, I'm getting hot. Okay. Start at the top, close to the drain insertion site, and go all the way down to the tube. Emptying the drains. Empty each after you've milked your drain, and you have the gunk in your grenade in your drain, or I'm sorry, after you've milked the tube, empty each drain twice a day or more if the suction bulb gets full. Record the amount of fluid in each drain separately. I don't even know what I'm reading. I'm just reading this out loud because I'm still stuck on the cow thing. Use the drainage record at the end of this pamphlet. How to empty the suction bulb. That's these lovely pictures here. Lovely. And like it will be clear at some point. I'm sure it's going to look pretty nasty first. Open the plug at the top of the suction bulb. Again, this is just for mine. You might have different grenades or suction bulbs or drains, whatever. Pour the fluid from the bulb into the measuring cup. Add flour, mix, and put it in the oven, and then you have brownies. I'm sorry. You have to find humor in all this stuff. Whew. Pour the fluid from the bulb into the measuring cup. Squeeze the bulb to empty it completely. And then your brownies will be super fluffy. Measure the amount of fluid. Write down the amount of fluid from each drain separately. I hope that you get that I'm not a medical doctor in the absolute least, and I'm just adding humor in here. Squeeze the air out of the bulb so you don't have, get gas from eating your brownies. And close the plug. The sides of the bulb should be indented. Well, that's not a pretty brownie. This is what creates the suction to dry out the fluid. Really? Oh! Okay. After measuring and recording the amount of fluid, you can flush the fluid down the toilet. Moo! All that waste of milk. Phone calls. A medical assistant or nurse will call you. I already said that. Breast oncology will call you too and discuss the results of your pathology. Again, leg pain, call if you have fevers, chills, nausea, vomiting, shortness of breath. Leg pain, severe pain, not relieved by medication. 8 to 5, call the plastic surgery office. After hours, call the main hospital number. Call 911 if it is an emergency. Your surgeon will remove your drains at the first appointment after your surgery if the amount of fluid collected is 20 to 30 cc's daily over 48 hours. Drains will be removed over the first 1 to 3 weeks after surgery, depending on output. You'll need to record the amount of fluid on the drain record. A drain can remain an extra day or two, but it is important not to remove it too early. After the drain or drains are removed, you have pretty boobs. Just kidding. Hold on. Keep a piece of gauze over the drain site until there has been no spotting on the gauze for 24 hours, just like a period. When your boobs stop having their period, you're good to go. This is usually 2 to 3 days after the drain is removed. Special instructions blank. Yay. Oh, here's their here's their chart. Just looks different. Notes. I don't feel like taking notes. Oh. All right. That's it. I gotta go now. Holy nausea. Okay. That's my medical stuff. I have to read that in more detail. Get that organized and not just a pile of papers. And stop being nauseous. I'm glad I can have a little smirk on my face. And I feel nauseous. And I have ginger ale, which was a good thing to have around. So I'm gonna go fill myself up a cup of ginger ale. Fold my laundry eventually. And pick up my son and have some chill time. Tomorrow I want to show you that stuff over there, which are all the clothes that are working for me that make me look pretty. All the way from grunge to leopard skin. Stay tuned. That's all I got. Thanks for being part of our amusing cow medical. I was crying, I was laughing. We went all over the place. That's kind of how this process is. You know what's one random cool thing too that I ordered from Amazon, which I will share with you quickly? Like bookmarks fall out all the time. I found these. Oh look, none of them are pink. Haha. So I found these, and they are like bookmarks, but they go around the actual book. And the finger goes this way. The finger points to the actual line that you're on. Like I have a ton of books here to read. I think I'm not going to read. I bought, or someone, actually a friend of mine sent me Seth Rogen's book, but I think if I read this, I would laugh, and laughing might hurt. But the way it works is like you wrap this around here, around the page, and then it like, you know, the thing stops at like whatever you're line up to, or whatever line you're up to. So random fun fact at the end of the day. All right, that's it. See you tomorrow, day 41. Bye, everyone.